All right. Hi, everyone, and welcome to the PFCC Partners October workshop. I'm Lindsay Galley. I'm the Director of Education for PFCC Partners, and really looking forward to today's topic. We are thrilled to be joined by some teammates from EPIC, Andrea Meinhardt and Dana Dembski. We're also joined by Rosie Bartel. So Rosie is on the EPIC Patient Family Advisory Council, and Andrea and Dana are here to talk all about EPIC and what patient-centered care looks like for their organization. Before I pass it off, I think we are all quite familiar with Zoom, but if you are not, there is a toolbar. So if you hover over your screen, that is where you can find everything that you need to be an active participant in today's session. I will ask that everyone keep themselves on mute for the duration of the presentation. We will have plenty of time for Q&A at the end of our session today. So if any questions come up as our presenters are getting started and sharing information, please put all of those in the chat box. And I know looks like a majority of you have found the chat box. So please use that all throughout our session with any questions, comments, ideas, anything that comes up, please put those in the chat box. Would love to see everyone's smiling faces. So if you would like to put your camera on, like a few of us are, please do so. Hi, everybody. And then during our Q&A portion, if you would like to come off mute and ask a question, Zoom actually has a new feature, and it is the reactions button. So if we want to test it right now, if you could find the reactions, it should be like a little smiley face with a little button, or you might have to click more and then go to click reactions and just pick your favorite one. I'm gonna pick a little celebration. Hey, me and Andrew are the same. Awesome. So you can use any of those and to let me know that you would like to come off mute and ask a question or share something during our Q&A. And we are PFCC Partners. We are a patient-driven organization, and we all serve in the role of patient family advisor anywhere from our local hospitals or healthcare systems to national partnerships as well. And everyone at our small but mighty organization utilizes our experiences as patient family advisors to really support the partnership of healthcare providers and patients and families all across the healthcare continuum, even when it comes to health information technology, like we'll be learning a little bit about today. Because we really know that the best possible health outcomes happen in that partnership. Oh, I lost. There we go. And this is just a quick image of how we work, again, using our lived experiences as patient family advisors to serve two of our communities, the healthcare organizations and patient family advisors, all in support of healthcare organizations, partnering together with empowered patients and families, all in the name of healthcare improvement. And we do that by facilitating a network of patients and families, the PFA network. This is a highly engaged, very empowered community of patients and families, all using their lived experiences to inform healthcare. So if you are new to PFCC Partners and you are a patient family advisor, please consider joining us in the PFA network as well. But with that, I am going to pass it off to our presenters today. So I think, Andrea, you're going to kick us off, and I'm going to stop sharing.
Yes, I will. Thank you very much for that introduction. Let me go ahead and start sharing here. All right. And Lindsay, do you want to just let me know? Can you see my screen okay?
It looks great. Yep.
Thank you very much. All right. Hello, everybody. Thank you very much for having us today. We are very excited to be here to talk to you a little bit about how EPIC uses patient feedback in our software development process. Let me just get my mouse working here. All right. So as Lindsay mentioned, my name is Andrea Meinert. I'm a quality manager on our patient experience team here at EPIC. I work very closely with our software, and then I also help connect project teams with opportunities to work with patients. With me as well today and taking over the second half of this will be Dana Dembski. I think Dana's gonna pop in. There she is. We are in the same room today. Dana is a user experience designer that works specifically with our MyChart application. So Dana will share a little bit of a different perspective, but we both work very closely together on patient experience. All right, so I wanted to start off with a little bit of who we are as Epic, for those of you who may not be as familiar with us. So Epic is a company that provides electronic medical records software. Our mission is to help people get well, help people stay well, and to help future generations be healthier. And as you can see here on the screen, we have this wonderful smiling face saying that with everything that we do, regardless of what team you happen to be on at Epic, we keep the patient at the heart. So sharing here some quick facts with you all. We were founded in 1979 in Madison, Wisconsin, and we're currently located just south of Madison in Verona, where we do all of our research and development. We have offices across the country and across the world, and we are employee owned and independent. Shared a couple of pictures here on the left. That is actually our first office back in 1979. We were in the basement of that building. And on the right is one of our buildings here on campus today. We have several very whimsical themed buildings. This is affectionately known as Oz. And as you can see, we like to have fun here at Epic, and you can see that in our campus design. So we've grown a lot in our 40+ year history, but what has not changed is that we continue to keep the patient at the heart of everything that we do. So as I mentioned, Dana and I are both on the patient experience team here at Epic, which means, of course, we are very concerned about patient success, patient experience, and our mission is empowering patients to get and stay healthy. A couple tools we have available that you might be familiar with are MyChart and MyChart Bedside. MyChart is available on the web and as a mobile app, and you can use that to manage your everyday healthcare. And MyChart Bedside is something that you could use in an inpatient setting to track your visit and your hospital information. So these tools are designed to help you throughout your healthcare journey. So whether you're looking for care, you're preparing for care, you're receiving care, or you're following up on care, we want to provide you with options to engage you in your healthcare, or if you're managing the healthcare of somebody close to you. So at Epic, we practice user-centered design. So for MyChart, in our case, the user that we're practicing design for is the patient. So in order to design for patients, we have to go out and talk to patients. So here on the screen are just a few of our established venues where we work with patients. I will note that this is not the full list of opportunities that we have. We have unique opportunities pop up all the time to work with patients, but these are some of our established ongoing efforts. So first, Epic has their own PFAC group. This is a group that meets every 2 months. It's a discussion-based group, which typically involves our project team asking questions to understand how patients receive care on a specific topic. And then they can also show a design and check if that design is going to meet patient needs. We also have the Epic Patient Registry of Volunteers. This is a group of volunteers who sign up, and we do 2 methods with this group, either one-on-one studies or surveys. One-on-one studies typically involve the patient getting on the phone with a member of our project team and walking through the workflow while our project team observes. We can also send out surveys, and that's a really great way for us to quickly get patient preferences collected. And finally, we have had a lot of really exciting opportunities lately to attend some PFAC groups at healthcare organizations. We have been going remotely, but we have been joining and sharing, again, similar projects and discussion topics to our Epic PFAC group. All right, so here at Epic, we use the industry standard double diamond approach. So this involves using convergent and divergent thinking throughout the design process. So we start here with an idea, and then we go out and explore, do some research, go far and wide to find out as much as we can. And usually once we have a good understanding of the problem, we can come back together and move on to the design phase. We follow a similar process through the design phase until we can come back again and settle on the best solution. So I do want to call out, this is not a linear process. Throughout this process, we often are revisiting things. Maybe we get to the design and we realize we didn't quite understand the problem thoroughly. We can go back and do more research again. So we do iterate quite a bit throughout this process. So all user-centered design involves research. If we want to understand the problem, we need to understand what patients are currently experiencing, what is important to them, and ideas they have for how we could improve their experience with managing their healthcare. So on the screen here are a couple of examples of ways that we do research. The first two are fairly similar. The first is focus groups. It usually involves discussions with a small group of individuals where we really try to get to a level of depth to understand their healthcare experiences. And then user interviews would be the same thing, but in this case, it would be with one individual, which allows us to go into a little bit more depth. We can also use surveys. Surveys aren't a tool that allows us to get into that depth like user interviews do, but it allows us to catch a larger volume of feedback at once. So oftentimes a lot of these options can play together pretty nicely. We also have immersion opportunities at Epic. What that looks like is we actually go out to the healthcare organizations and just observe healthcare, how you interact with your care team, how you move along through the process. And that can inform a lot of the decisions that we end up making as well. So putting these all together, we can form personas. And personas are essentially characters that we create that embody all of the information and feedback we received from you through the research process. And these personas really help us create a shared project vision. They promote empathy, and they provide a North Star for our project team so that as they're going through the process, they always have that patient in mind. All right, moving right along, at this point, we are ready to design. We've done our research. And so we, again, can use a variety of methods to continue to research our design and validate that effort. So again, at this point, we understood the problem. We're moving on to the design phase. So again, we're going to go out and get patient feedback at this stage. These first two options here are similar. A lot of times we have multiple ideas for how we could solve a problem, but we really want to find the solution that is going to be the best. So A/B testing is where you as a patient would walk through multiple workflows and we would be able to determine which one is the easiest for you to complete. And then preference testing is for you to decide which one you prefer. So similar, but now you're kind of picking more from a preference versus being able to complete the workflow. And then card sorts are another tool that we use. This involves maybe having multiple pieces of information and making sure that we're ordering them in a way that makes sense. So some activities that's going to be chronological, but a lot of activities you might want to see stuff listed in order of importance to you. So there's a lot of ways we can go about it, and card sorts help us get to that solution. So moving on, eventually we do settle in on the design decision, and it is time to start developing that code, and our developers get hard to work. So these examples on the screen here are actually not methods that we get patient feedback, but I did want to share some internal things that we do as well to make sure that we're guaranteeing a positive user experience. The first one here is an industry standard tool called usability heuristics, and I'm going to throw those up on the screen for you to look at. This is something that every single project is evaluated against, and you have to pass every single one of these 10 usability heuristics to be able to move forward. So again, I'll leave those up just for a second for you to review. We also have accessibility guidelines that we follow. We have a group of experts that review designs to make sure that we are designing software that is accessible for our entire patient population. And then we also have some Epic established guidelines that we follow. First, our style guidelines. What we want is for you to have a similar experience, whether you're maybe using MyChart to refill a medication, or if you're in an inpatient setting using MyChart Bedside, we want that look and feel to be familiar to you regardless of how you're accessing that. We also have the patient health literacy checklist, which helps make sure that any new words or phrases that we're adding are approachable to all of our patient population. So we understand that healthcare can be confusing or difficult regardless of your experience going through healthcare processes. So we want to present the information in a way that is intuitive and easy for patients to understand. All right, so now moving on, we do once again test the development, and this time we go back out and we're working to really validate that our solution is correct. So we want to make sure that nothing was lost in translation from our research all the way through the portion of our development. So in task-based workflow testing, for example, we would meet with patients and have them actually walk through the workflow and complete tasks.
Hello?
We can gauge yes, no, they can complete the task, and we can also collect more feedback again on how they feel the experience went. So now we've had multiple opportunities to receive patient feedback. We want to analyze our results, make sure that we are implementing everything that we got and applying it in the appropriate way. So again, you're getting the best experience possible. So again, you've had opportunities at this point to provide feedback during research, during design, and then through development and testing. Once we have all of that feedback, what we want to do is benchmark our workflows. At Epic, we are constantly looking for ways to provide you with more options or to enhance the workflows that you see. So as we do that, we want to understand what the current patient experience is so that as we seek to add more options, we're not degrading your patient experience, we're only making it better. So to summarize, you've now helped us refine a final product. Your feedback helped at each step of the way to understand the problem, design the solution, and then validate that the solution will work live. Oftentimes when we chat though, you guys have really great ideas for other things that we could be doing to improve your patient experience. So we can take those ideas, keep track of them, and then kick off the process, one more time and start at the generation phase and research phase. So to recap, there are multiple points where we might get patient feedback. One of the things I do want to call out here at this point is that the timelines for these things can be very different depending on the software or the type of feedback you're getting. So Dana's going to talk a little bit about a specific example of a project. And this is a project that took us a long time to complete because we wanted to get it right. It was a large overhaul of something that was existing. So in that case, you might have been giving feedback on something and not have seen it in your personal MyChart for months, for years. So sometimes the timelines can be a little more slow. Oftentimes there are certain events that cause us to move with more urgency as we are still very much in the midst of the COVID pandemic. We did a lot of development related to COVID that we wanted to get to you as soon as possible to manage your healthcare through the pandemic. In that case, you might have given feedback on something that you would see at your fingertips in just a matter of weeks. So this can vary greatly. And I do want you to know, if you do ever have the opportunity to give Epic feedback, that we do hear your feedback. We are working on implementing your feedback. It might just take a little bit of time until you see that impact. All right, so with that, I'm gonna let Dana take over. She is going to literally roll into the screen here and talk to you a little bit about a specific example.
All right. All right. Pretty fun experience to just roll on in. But hi everyone. Like Andrea said, my name is Dana Dembski and I am a user experience designer for the MyChart team. So if you're not familiar with what a user experience designer does, just real quick, I'm often the person who is translating your feedback into what you actually see on the screen, where information shows up from the whole info hierarchy of everything all the way to designing icons to hopefully clarify what some of the information is that we're showing you. So I'm going to show you a little bit about a project that we did recently that used all of this feedback. Just this. All right. So if you use MyChart, you likely recently saw a big change to your homepage experience. You might have seen something like this in the past, and now maybe you see something that looks like this. But what you don't see from this change is that this project was the product of almost 2 years of research, design, and development and testing. 2 years of that double diamond that Andrea was just talking about. The work that we did, especially in the usability and design space, was all done to ensure that patients have an experience that is intuitive, easy to use, and feels tailored to their needs. So this is just a really great example of a project that was for patients, informed by patients every step of the way. So I'll share a few of those patient feedback touch points that really changed and shaped the outcome of this final product. All right, so even before we put pencil to paper or fingers to keyboard, we started with an initial survey of our PFAC group and customer PFAC groups to gather qualitative and quantitative data. We asked open questions such as, what's your favorite thing about my chart? What could be better? And then we asked some more targeted questions like, what activities do you go to every time you log in? Which ones do you maybe access every once in a while? From this, there were really two major takeaways that were themes throughout all of the feedback we received. We learned that patients wanted to really easily get to those activities that they use a lot. If I go there every time, like take me to it quickly, right? And then second, patients were somewhat confused and had challenges when switching from mobile to web due to those differences in navigation. So how could we address that in the design? Also early on, we conducted card sorts actually in the waiting room of a primary care clinic. And of course, this was pre-COVID. Maybe we wouldn't want everyone touching cards today, but card sorts are one of the research methods that we can use here at Epic. And they're a way to see how users mentally organize and group information together. So for this in particular, we asked patients to group similar MyChart tasks into buckets to see how different functionality in MyChart is related. And at the time, maybe patients thought it was just a fun activity, grouping stuff together, making little buckets of information, but this actually directly turned into how we structure the menu of our new homepage. So early informed research on that front. We took all of this early research work and turned it into high-level project goals, which you can see on the screen here. These patient-centered goals drove the entire project for the following about 1.5 years. These were so important to our project and to our success, because as we added new folks to the project team, these principles were invaluable to onboard them to the pillars of the new homepage, so that even people that weren't involved in those early research investigations I mentioned, we're still able to understand what we got out of the research. So you can see here that one of those pillars is number 1, make it easier to find patients to help patients find what they're looking for. That was directly from the PFAC surveys that we did for the first part of the project. So as we go through the project, we made sure to ask questions and do usability testing based on these 5 principles to ensure that we were hitting the goals and not forgetting about them as we went along. All right, now for some fun throwback visuals to really show you the impact of the patient feedback and usability work as the design evolved. So what you're seeing on the screen now was one of the very early design ideas for the new homepage. You'll notice that it looks quite different. A couple of things to call out here. Note the absence of any menu button on that web mock-up right there. And the use of the magnifying glass for the menu on mobile. You can see that big magnifying glass in the middle. It says Explore on the mobile screen there. That was supposed to be our menu, and patients could not figure out how to get to the menu when it was like this. And then additionally, we had really colorful cards. I'd like to call out real quickly what a card is, if I refer to that term throughout this presentation. A card is what I've highlighted in red here. In web design world, that just means these square pieces of information that you see on your screen. So if I say cards, this is kind of what I'm talking about. So we made these really colorful, right? One of our principles was to bring joy to patients and to make it really fun and try to bring a smile if we could, even though they were maybe navigating some tough healthcare situations. However, while this was joyful, when we showed this to patients, many perceived that these overly colorful cards kind of look like ads that you see on the side of your screen on the internet. And patients actually took longer to find the actual info on the page because there was so much fun and color and lack of consistency. Also, when we showed this early design to patients, note these little tiny labels on the top corner of the cards. This was our first attempt ever at creating an integrated view where you could log into the homepage and see your own information and also the information of those you manage, such as a parent, a child, a spouse, etc. And when we showed this to patients, especially our parents, they loved the concept, but we got unanimous feedback that it should be separated by person. Patients made it very clear that they think about health related to one specific person at a time, not a list of everyone's stuff that's just the most recent. They told us that, I'm thinking about my kid today and like what he's gonna need, not, my stuff intertwined in there as well. So this was like one of our early attempts at a design. We did a ton of usability testing, one-on-one testing, and task-based testing. And you can see that we jumped forward a few design iterations, and you'll notice that based on that feedback, we now have a much more traditional and understandable hamburger menu icon with the actual word menu there. We have this concept of sectioning off the card elements by patient, and we toned down the color on some of the cards to make it feel less like ads. Now, this was a big improvement, but we definitely weren't done. We tested this version again. We did more task-based testing with our patients, and we heard more feedback that there are still ways to improve. One of them being that the cards were still a little bit too colorful and busy. We did cut down on the time it took for patients to get to the right piece of information, but it could still be faster from here. So let's jump forward many more designs to our final design, where we made a few key changes based on that feedback. We really standardized the card formatting and coloring to ease in reading and finding that action information easily. On web, you'll also notice, I'll go back here, we had this idea of a 2-column layout. Patients told us that's kind of confusing. I can only take in one piece of information at a time, right? I can only read one thing at a time. So let's just make it one list. So instead of 2, you'll now see that we have just one linear experience. So you can take in one piece of information at a time and move forward, making it feel a lot less cluttered. And these are just 3 snapshots of the probably hundreds of design mock-ups and changes that were made in the life cycle of this project. So this is just a couple of the few feedbacks that really informed how we got from our very beginning state all the way to the end.
Hey, so, but you said everything was good?
Overall, we ran 45 studies spanning 815 participants. These participants came from a variety of backgrounds, including PFACs, direct patient engagement in the clinics, as I mentioned, and people who came to Epic. So it was really an awesome experience to make sure that we were taking all of your feedback from beginning to end. All right, all done, right? Nope. As Andrea mentioned, we get to the end and we're never done. Even though this experience is now out in the real world for you all, we continue to hear your feedback and adjust to continue to make this an even better experience, from the little things to the big things. One kind of cool example is that in patient interviews towards the end of the design process, we heard that patients would love to be able to have the ability to choose what shows up in these quick action links. The original idea was that we took all the survey information and put the top 4 that patients used here ourselves, but we loved that idea that patients would get to personalize these and make this feel like a much more tailored experience. So we took that concept back to the very beginning of the Double Diamond and designed a way to personalize those that just got recently released, actually. We now have a change your shortcuts option in my chart today that most of you should be able to do now, where you can actually make that whatever you'd like it to be. So that's just an awesome example of the ongoing feedback and functionality that we continue to hear and continue to act on. All right, I think this is where I hand it over to Andrea to introduce Rosie.
Let me roll on back in the screen. This is by far the most fun we've had all day is rolling around this room. All right, so I want to introduce Rosie, who is here with us today. Rosie is a volunteer who helps us out with our EPIC PFAC and also participates as part of our EPIC Patient Registry of Volunteers. So Rosie, whenever you're ready, you can have the floor and talk to us a little bit about your experiences.
Okay. My experience has been with EPIC and the work that I do with them extremely helpful and also very rewarding. I can't wait until the 2 months are up, and we meet from like 6 to 8 in the evening. And some people will say, do you really want to work at that time? But I have to tell you, the 2 hours goes so fast. And I sometimes think these people aren't going to come back. We've been really rude to them tonight because we do pick things apart. They do hear us, but then eventually it comes back to us and we see our changes. We see what we said. I look at it this way. We are the voice of experience. We have this lived evidence, this lived experience, and we share this lived evidence and lived experience with the people who do the design and development at EPIC and the research. And I think that is so key that, every step of the way, and I mean, now we've gotten to know some of these researchers. And I guess the thing that made me happiest, a couple months ago, one of the researchers said, do you understand that there's a waiting list to come and see you guys, to come and share what we're working on? And, my answer to that was, well, then we'll just meet monthly, because I just, it's worth the time, the effort. And I've done, I'm on the patient advisory council, and we all, none of us are afraid to speak up. I've brought some new people to the group, and they all speak up. They're so open to the voice of the patients and the caregivers. And I mean, we have as many caregivers, I think, in the group as we do patients, and especially caregivers of children or older adults and family. And then I have been involved with several usability or volunteer registry studies, and those are also very interesting. It's worth the hour when they ask you. I never say no to you when you ask me, because I'll find an hour in my time, because it's always worth the time. I really believe in that, the fact that you're looking at what the patient wants. I mean, we have watched this, page grow and develop over time. And I have to tell you, 6 years ago, when we started talking about patient portals as a committee that worked with our group, and that's how I eventually came to you. And we looked at it and said, this would be great if it were patient friendly. And now it's getting more and more and more patient friendly. And I always say to people, and I can't wait till they finish and show the next thing they're doing. Because I mean, we see things sometimes months and months and sometimes years ahead of you. And it's like, oh my God, I can't wait for this to happen, because it's going to be so cool. And I that's the way I feel about all of the work that's happening, because you hear us. I have to say, it's one of the few places I go that I feel like my patient experience and my life experience is validated. They hear me, they hear what I have to say, and they put it into action. And so, I can't say enough positive things about the work that's being done by the people that work in patient experience and in research and development. Thank you for letting me put in my 2 cents. As everybody on this group probably knows me and my 2 cents, so but I feel strongly about this. It's one place I don't like missing a meeting for any reason on earth. So it's important.
Yeah, thank you very much, Rosie, for sharing your perspective there. And just know we appreciate you, and we get so much out of your feedback. So we love to hear that you get something out of it as well. Of course, our goal is to, have it be a two-way street. So again, thank you, Rosie, for speaking up and being willing to share today. All right, let me advance one more slide here. All right, so we've been talking a little bit about some of these venues that we have. And these are available to you if you are interested in joining. So we want to have an action item here at the end. If anything you heard from me, from Dana, or from Rosie interests you, you do have opportunities to get involved. So first of all, our Epic PFAC, which again, Rosie said we meet every 2 months. It's still every 2 months. We have not made it more frequent, but maybe, if we get enough folks, I'm sure we could move that up to 1 month or more frequently. But we meet the third Tuesday of every month, every 2 months, excuse me, not every month. See, Rosie, you're contagious. You're getting me on board with that plan too. So we meet from 6 to 8. It's 2 hours every 2 months again. So hopefully not too much of a time commitment, but it's really an opportunity to discuss new projects that we have coming down the pipeline. And I included the email address there. If you are interested in getting involved, send an email to that address and we'll get in touch with you. The Patient Registry of Volunteers is a little bit more kind of sporadic, I will say. It's not a guarantee that you'll be contacted every so often, but this is a list of volunteers that we have available and reach out to schedule those one-on-one sessions with our project team. You also might receive a survey, maybe opposite of how often you end up getting invited to a one-on-one session. So again, this is potentially a few times a year, depending on your preferences. If you're like, I want to do this once maybe and try it out, but not more than once a year, we can be respectful of that. If you want to do it more frequently, that's good to know as well. And you always do have the option, if we reach out to you and now it's not a great time, to defer until a future date and we can keep you on the list. So that is a slightly different email address that is included there as well. That's that patientusertesting@epic.com. If you have any interest in joining that group, go ahead and send us an email at that email address. And then finally, we do have kind of our newer option here that we're really excited about, is we have been invited to some of your healthcare organizations' PFACs to talk with patient groups that are established at that healthcare organization. So if you're a member of one of those groups and think that Epic coming to talk to your group would be a positive experience for the members of that group, go ahead, again, send us an email at that email address. We would love to come and speak to you about something that is interesting to you or about some new projects that we have coming down the road. This is, again, something ad hoc. We can come once, we can come on a more recurring basis. If the first time goes well and you want to see us again, we would love that. So again, this is kind of as needed. If you have any interest here, let us know. I will call out, all of these options are remote. So, it's getting colder in Wisconsin. If you have heard horror stories about our winters and you don't want to come up to Verona, we have remote options. We meet remotely, so you do not have to leave the comfort of your own home to come talk with us. So I'll leave this up again, just a couple more seconds, jot these down. I believe Lindsay will send these email addresses out after the meeting as well. But please, if you're interested in getting involved or interested in learning more before you're comfortable getting involved, just go ahead, send us an email and we're happy to work with you. So with that, we do want to open up the floor to any questions that you have for us.
Yeah, thank you so much, Andrea, Dana, and Rosie. This was extremely informative. And it was really interesting to see that kind of how you put your strategy in place when it came to redesigning the My Chart. And I'll say that I've been a part of some user testing, and it's not intimidating. It's fun. You just kind of sit with somebody and go, they give you control and you just click through, and that they're really listening to kind of your processes and your ideas of what could make this better. So would highly recommend getting on that list for anyone who's interested. But yeah, thank you. This was really great. And we did have a couple of questions that came through in the chat. One was, if you could provide the patient literary checklist, if that's something that you could share.
I'm going to let Dana roll into you.
Okay, again. Yeah, so I'm super pumped about our patient health literacy checklist. That's actually an initiative that I've been leading over the past year on the patient experience division. I've been working really closely with the Wisconsin Health Literacy Group, the director over there, to make sure that we have all the right resources to evaluate our text with. I'd be happy to share our checklist with you all. It's definitely applicable to anything that you're editing that other people are going to read, honestly, because it's universal design. If it's easier for me to read, it's even easier for doctors to read. So I can, Lindsay, send you a PDF version of that after the meeting and share that with you all.
Great. That sounds great. Thank you. And then I think kind of along those lines, there was another question from Mary, where to go? Oh, have you considered or do you offer training to patients and caregivers on the best ways to use their electronic health records?
You want to go ahead?
Yeah, sure.
All right.
And maybe we could just like both.
We'll tag team it. Yes.
Yeah.
So the thing that I was going to mention, not sure what you were planning to mention, is that something that we've been doing is creating a library of patient-facing videos.
Oh, awesome.
Help you watch and learn about how to use your portal more effectively. We actually have an Epic YouTube channel where you can watch a variety of videos, and that's a link that I can send to you as well, Lindsay, afterwards.
Yes.
You'll also start to see some of these videos actually in your MyChart systems on the corresponding pages. And another feedback point here, we heard from patients that they were having trouble finding these videos. So we're actually right now working on a project to make a library of these videos within your MyChart so that you can find them more easily. But I will send you a link in the meantime before you see that in your own MyChart.
Awesome. Yeah, that would be
That's
great.
exactly what I was going to say. So we're on the same page.
Perfect. That sounds awesome. Let's see. And there was also a question about Epic Bedside. Can you talk more about that? And yeah, if the Bedside MyChart or MyChart Bedside, just talk more about that.
Yeah, I'm happy to talk a little bit about that. I'll give a high level overview, but if folks have more specific questions, let me know. MyChart Bedside is a tool that is available for folks, like I mentioned, in an inpatient setting. So there are kind of two ways that you can receive access to that. Number one, if you're admitted in the hospital and your hospital uses Bedside, they can actually provision you a tablet. So they'll just give you a tablet to use that will have Bedside installed, and then you can access it that way. The other way you can access it, which is fairly new, but we're really excited about, is it can show directly within your MyChart app. So maybe use your MyChart app all the time, and now you're in an inpatient setting, your app will automatically switch over to the inpatient view for you, so that you can see all of that information while still accessing the stuff that you have in your day-to-day care. This can also be really helpful if you have proxy access to anyone, for example, maybe a child that you have was admitted and is receiving care. You can again see that from your phone. So even if you're not at the hospital at the time, you can check in remotely. So we have a lot of features within Bedside. A lot of it is kind of tracking your care so that you can see, your care team and who's taking care of you. You can read educational materials. I know, Rosie, that was a project we brought to one of our recent PFACs, was a kind of a refresh of our education screens for folks to be able to educate themselves. Again, knowing that, you might be experiencing something new and have to read up on what exactly you're being cared for in the hospital. So it is similar to MyChart, but again, all of the activities are tailored to your experience as a patient admitted to the hospital.
And I will add one thing, kind of a fun epic fact, little known fact. The idea for Bedside actually came out of a bunch of developers in the early 2000s going on an immersion trip to a hospital and being like, we need something for this, guys. Like, patients are sitting here and they don't know what's going on. They have the whiteboards in the hospitals where nurses come in every once in a while and update stuff on the wall, but wouldn't it be cool if, like, we're a tech company, we could do this? So that's actually a really kind of funny story about how it came to be.
Nice.
Well, and that's funny because my statement about the Bedside is, when I talk about MyChart Bedside, I always say it's like replacing the whiteboard, and it's up to date. It's not old information, because I have a real problem with whiteboards, and people start out with information, but then by the time you're there a day or two the information is not valid or good.
Mhm.
And now your bedside, my chart is great. Now I know that I'm telling you, it's hard to sell to some hospitals, and I've been really pushing it with some hospitals that I work with because I don't know why, but they're dragging their feet. But I'm hoping that I've at least convinced them to try it in some departments, so that I think once they find it that it's valuable, then they'll put it in all the departments. So, or even try it in one of their smaller hospitals. So,
Nice.
not everybody wants to jump in to do the bedside, but I think it's like you could take all those whiteboards down once you do it.
Mhm. Absolutely. I did have a question. We do have some organizational representation from healthcare organizations and some that do use Epic. I saw Joy in the chat say that they worked with their local patient family advisory council on the design of their local Epic MyChart. So I'm just curious, any resources, tools, thoughts, ideas around healthcare organizations partnering locally with their patients and families when it comes to kind of their local Epic MyChart?
Yeah, I don't have that information, but I believe we do. It's actually something that we recommend to our new customers. You work with Epic, we get you set up with MyChart and patient experience tools, and whatever you're doing, even if you're not outside of MyChart, right? We want you to have a PFAC group or a similar group so that you can work directly with patients and understand ways to improve their experience. So I'm going to check into if we have a sheet that's ready for that I can share of like best tips and tricks there. But I will say we take a lot of information from what you all are doing at your healthcare organization. So we kind of model off of what you all are doing as well.
Nice. Awesome. Thanks, Andrea. And also, if we could share any information for organizations who are maybe using homegrown portals or different ones that might be interested in Epic MyChart. I know I've seen a few comments in here like, I want this in the chat. So any other information that you could share for our healthcare organizations, I think would be great too.
Yeah, I'm wondering if I know we have brochures, and we can work with some of our folks to see what information we can provide for folks that are maybe interested in using MyChart.
Great. And there was a question along those lines. So who are some of the client or health systems that use the Bedside MyChart currently?
That is a good question. I don't actually know like the specific list, and I would be afraid to share because some folks are maybe not quite there yet. They're implementing it, but they're not live. So I'm not entirely familiar with that list off the top of my head.
The only thing I will say is that we have hundreds of hospitals using Bedside right now, so it would be a very long list. Pre-COVID, I was able to go on an immersion myself. Actually, just to call it one specific organization, to CHOP in Philadelphia, Children's Hospital of Philadelphia, and they were using Bedside in their pediatric context, which was quite interesting. And that's just one example of a couple hundred, but I know they're using it because I saw it.
I know they're using it as well because that is an example of a PFAC that we attended with CHOP, and we showed them a MyChart Bedside project, which was really exciting. So yes, that is an example of someone that is using Bedside.
Great. And we also have Maureen in there. It looks like Cedars-Sinai is live with MyChart Bedside for peds and adult too. So awesome. And we had another question from Dr. H. Any pushback from seniors that don't feel comfortable with technology?
Yeah, that's an interesting question. I think the one thing I will say, pushback, yes. And I think we make an effort to work with that group specifically. We want to hear from that group who's maybe not as comfortable with software because, maybe for me, I'm 25, I've had my iPhone since I was in 8th grade. I can navigate, the app and figure that out just from experiences of working with different types of technology. But we understand, that that's not the case for everybody. So we do make an effort to work with groups in the older population or groups that for our patient registry, for example, we have folks kind of self-gauge how comfortable they are with technology, both on the website and on the mobile app. And a lot of times we're targeting that group specifically for feedback to make sure that it's a usable experience for them and not just expert technology users.
On the other side of that is I'm almost 50 years older than you. And, I use the technology every day. Now I know that there are hospitals where they, like the nurse will help them with the bedside, application, especially if they're using the iPads at the hospital, and not using it on their own phones, or they don't have my chart on their phones. But I think there's all kinds of ways to get around it. During COVID, some of the people found that the bedside was very helpful because it was another way for families to stay connected to patients inside the hospital when you couldn't visit.
Mhm.
So it was just another way of feeling like you were somewhat in control of helping your family and your loved ones through the healthcare situation.
Yeah.
Yeah, there's a lot of things to be aware of with comfort level. I know we talked about patient health literacy, right? That is something we need to consider, groups that maybe don't have a ton of experience through the healthcare journey, and combining that right with folks that maybe aren't as familiar with technology. So there's kind of a lot of overlap in different groups there.
And part of patient health literacy, there's like a subset of digital health literacy, and making sure we don't refer to elements of tech that no one is going to understand, and that's kind of baked into our health literacy principles, at least for the wording side of things.
Right. Absolutely. And I guess kind of along those lines of accessibility, I was just curious because you talked a little bit about accessibility of anything else that Epic is doing when it comes to like equitable access to technology and things along those lines. I know Rosie has been really passionate about growing the advisory council and ensuring that there is good representation of all patients and family caregivers there to really have all voices heard. So I'm just curious, anything else that when it comes to accessibility that Epic is doing?
Yeah, we have a big push around getting a more diverse patient population for feedback, right? Because if we only talk to, 30 to 40-year-olds in the Madison, Wisconsin area, that could be a very different experience from folks that grew up in a different region and are of a different age group. So we are working very hard to expand that group. And that's one of the reasons actually that we are trying to attend healthcare organizations PFACs. A lot of groups actually have their own groups targeted towards a specific need. So it could be maybe a group that all shares the same ongoing health concern, like, cardiac issues or things like that. And we've also seen groups put together gender groups for LGBTQIA community. And that's, we're trying to tap into that as well to make sure we're considering all of those groups. We do have a group here at Epic that works specifically with SGN. So sex, gender, and names, to make sure we are considering all of those cases and all of those patient populations. And then for accessibility specifically, like I mentioned, we have a design process. We have an accessibility lead here at Epic who actually is homegrown from our MyChart team, so we know him very well. He works with us a lot to review to make sure that we are very specifically following guidelines to meet industry standards for accessibility. So again, if you use a screen reader, or if you are vision impaired, or any sort of situation, we want to make sure that we're accounting for those.
Awesome. That's great to hear. Did you have something to add, Rosie?
I have a sister-in-law who is blind, and she uses adaptable stitches things with her MyChart, so she can have it read to her. She can. One of the things that comes up a lot in our meetings is, especially, and Harvey just brought it up, colorblind. If you're colorblind and you have all these different colors at you, and that has come up more than once from the patient group. Why, if you say push the red button, I can't see red. I don't, but I think that's, all those different colors coming together. I think, you've made some changes to the colors, and I think that's been an improvement. But it's, you've heard us say, people that are colorblind, this is not always the best way to color is not always the best thing to use when you're trying to help patients through the process.
Yeah, that's a good example. We actually, I'll share, one of our specific guidelines is color cannot be the only way that meaning is conveyed. So we have to have text or some other tool, an icon, something that can convey meaning other than just color.
That's a great principle. And I kind of along the same conversation, there was a question about translation. So can my chart be translated into different languages?
Yep. Yeah, we actually have a translation team here at Epic. And then I know we have the framework in place to translate anything that you see on the website. So that is possible.
Yeah, I'm trying to remember how many languages we have now.
Oh boy.
I
used to know at the top.
Sounds like a lot.
There are a number of,
Yeah.
that's always the safe answer.
That is great. Awesome. All right. Well, we're wrapping up. I think I got to all of the questions in the chat. Were there any other questions or reflections? All right. Just kudos to our presenters today. So Andrea, Dana, Rosie, any final words for the group?
Well, I just saw Joe put in that it must be a great place to work.
Yeah.
It also is a great place to visit, but when you can visit again, because it is the most whimsical, fun place that you've ever been to, but it's got lots of miles. You better bring your walking shoes.
Yep.
Or you better be able to roll fast.
Roll.
I spent a week at one of their conferences, and after that week, I was probably I think David and I both were more worn out than we ever had been from any conference, but yet it was such a valuable experience for both of us, and it's very fast moving. David always would tell the story that when we went to visit the first time before the conference, they invited us to lunch, and we were in the lunchroom. And we looked around and we were like, oh my God, everybody is like younger than our kids are. This is a young group of people. But it's interesting. It's a fun, everything is fun. Everything is magical. I mean, you can go from, Harry Potter to Oz to the farm to
That's awesome.
Yeah, I believe we are open for tours again on the weekend. They're self-guided, but we'll give you kind of a script to follow. You can go down. We have 2 slides on campus within the buildings. We have a ginormous tree house. So if you are in the Madison area or ever find yourself in the Madison area, come on, stop by. You will, I think, get a kick out of it.
it's a fun
Awesome.
place.
Well, thanks for the invite.
Yes, of course. Well, and just so we don't, I want to make sure we say this before we run out of time. Thank you guys so much for having us today and for your really excellent questions. We are very excited, as you could tell, to talk about this subject. Happy to talk about it at any time. You have those email addresses if you want to reach out to us with more questions.
Yeah, ditto. Thank you all so much.
Perfect. Well, thank you both. And thank you, Rosie. We will follow up with everyone with those email addresses, the slide deck as well, and any other resources that we've talked about here today. So yes, thank you all for joining us for an hour on your Friday afternoon, and I hope you have a fantastic weekend. And thanks again, Andrea, Dana, and Rosie.
Hey.
We'll see everyone
Bye.
next time.
Thanks, everybody.
Bye.
Have a great weekend.
You too.
Bye.
Thank you both. And
Thanks,
Lindsay.
Rosie.
Bye, Rosie. Thanks.
Bye.